Hello everyone, my name is Dustin LaBelle. How would it feel if you or a loved one has been brought into a hospital and you are not seen for multiple hours at a time? Things can change drastically within minutes and can go completely missed, which can cause major problems, including death. Situations like this can all be related to high patient ratios that are caused by the nursing shortage. If these problems are not improved upon in the upcoming years, this sad example I gave will become more and more common. That is why I did research on the nursing shortage to understand and educate people on the causes, effects, and past efforts from scholarly articles, as well as perform a survey and interview on frontline nurses to gain their input. So the main cause of the nursing shortage is a high demand of healthcare. This is due to people getting older, they're living longer. When they live longer, there's more comorbidities that can go on. So people are starting to go to the hospital more and more over time. Another reason is due to the baby boomer generation. The baby boomers are finally getting to retirement ages and they make up a majority of the workforce as nurses. Once they are once they start to retire, we're going to start losing more and more nurses and we need more to replace their spots. And lastly, mainly is due to region. So there's a main difference of being in New York City versus somewhere that is a low populated area. There's more people in a more condensed area that need healthcare compared to a lower dense area. So the main effects of the nursing shortage. One of the biggest effects is the high nurse to patient ratios. This means that a nurse will have more patients than they normally should. This leads to all of the other effects, including burnout, which causes nurses to not like their job as much and eventually quit. It can also cause violence in the workplace due to either them becoming stressed, the patients not being happy, a number of reasons, and them not seeing patients start to get aggressive. It can also cause and is a risk factor of medication errors or errors in general. You're working too quickly, you're trying to get done, you're trying to get to the next person, and you accidentally cause an error. And lastly, it causes a low quality of patient care, which, if you take the burnout, the violence, the med errors, regular errors, it all causes low quality of patient care. So, the past efforts that have been done to try to improve upon the nursing shortage are better relationships between nurses and their managers and employers. If they do this correctly, then they will not be as likely to get upset with their employers. They will be able to talk to them. They'll be able to voice their frustrations. Another thing that they can implement is a focus on prevention. So instead of treating the new diseases coming up and having to give them medications, lifestyle change, all of that, if they focus on preventing the disease before it begins, it will save a lot of time, it'll save a lot of money, and people will overall be healthier. And lastly, they have been trying to increase the amount of high quality educators. With increasing the high amount of high quality educators, they will be able to have more competent nurses come into the workforce who do not need to be trained as long. So, with my survey and interview, I interviewed a float pool manager who is directly linked to a nursing shortage because the idea of float pool nurses is they go wherever there is a need for more nurses. Like, say, if they're short a nurse or if someone called out, that they deal directly with that part of nursing. And with my survey, I was able to get 37 responses, and they all were float pool nurses. It was a 10-question survey that went through different aspects of how the shortage can affect them. There's two examples of my survey down at the bottom. So, out of the survey and the interview, I had multiple good recommendations, but the main thing that it was hit upon was that management needs to start hiring more nurses because overall we just don't have enough in the hospitals. Survey recommendations. It was kind of like the small ones that were good, and there was multiple of each. Uh, Multiple people suggested better budgeting, improved benefits and salary, mandatory patient to nurse ratio, and use of LPNs, which are licensed practicing nurses. And the last main recommendation that was given that was most frequent was to make nursing school more accessible to new nurses and help them be able to get through the program successfully. So, in conclusion, there are many reasons that have caused the nursing shortage to become worse over time, and these have more effects on the nursing community as a whole. There have been many strides that nurses, educators, and employers have done to help deal with this ever growing problem, but still much more is needed in the coming years. Through education and dedication, the nursing field shall continue to grow and become the highly respected profession that it has always been. Thank you very much, everyone, for your time. And if anyone has any questions, I'm more than happy to answer them. You can reach out on the discussion board, and I'm more than happy to answer. And here are my references. Thank you again, and everyone have a great day.